guys, welcome to Only for Teens, a program that is dedicated only and exclusively for teens. Today we'll be talking about teen depression, and on the program we have Dr. Sarah Ravin. Thank you for being here on the program, Dr. Ravin.
You're welcome.
It's a pleasure to have you. According to Healthline.com, depression affects about 1 in 10 Americans, and approximately every year the number of patients diagnosed increases by 20%. Dr. Ravin, how prevalent is depression in teens?
Quite prevalent. About 10 to 11% of teens will experience an episode of depression by the time they turn 18.
And how can a parent distinguish between a teen that is depressed and one that is not, and is just being a normal teenager?
Very difficult distinction, because most teens are moody and unreliable at times, and sometimes sleep a lot and things like that could concern a parent. But if a teen is showing a lot of changes in their general personality, in their eating and sleeping habits, in addition to being sad or down or irritable for a few weeks at a time, then most likely there's a problem with depression. Normal teen moodiness generally comes and goes within a day or within a couple of days.
So if that persists or that continues and it's more drastic, you would say so that might be a sign of possible depression?
Yes.
And so that would be sort of like a symptom? Are there any other things to look for, or?
Social withdrawal is a big symptom. A lot of kids who become depressed will stop hanging out with their friends. They might quit activities or hobbies that they used to enjoy. They might spend a whole lot of time alone in their room. They might sleep all during the day and then stay up at night.
And what would you say are some common causes for depression in teens?
Well, we know that major depression is a biologically based brain disorder, so it falls into the category of psychiatric disorders such as schizophrenia, OCD, autism, ADHD, etc. We know that there's a strong biological basis for this illness. It tends to run in families, so people who have a first-degree relative, that is a parent or a sibling, who has depression are more likely to experience it themselves. And then on top of that, hormonal changes associated with adolescence, at puberty, that can really bring on a lot of changes in mood and behavior and personality that exacerbate depression. And finally, events in a teen's life, any sort of stressful event can be a trigger for depression in someone who's vulnerable. So for example, changing to a new school, going away to college, breaking up with a romantic partner, any of these things can be a trigger for someone who's vulnerable.
And would you say they all play in together, or is one factor more important or more powerful than the other, or would that depend on the situation?
I would say that biology trumps everything. Not to say that that biologically, if you're destined to have depression, you're doomed, or anything like that, but just that, you know, if you take 10 teens and put them in the same school and the same situation, one of them may develop depression and the others may not. Why? Because the one who did develop depression may have the biology, the wiring, to react in that way, and another one, for example, may develop a problem with alcohol because they're wired that way, or they have other environmental influences that sort of sway them in that way.
So genetics can be pretty powerful, and those biological factors.
For sure.
So then, whether certain teens are more at risk than others, then I imagine they would fall into that category, those with family members who have depression?
Yes. Teens who have a close relative, a close biological relative with depression, are at increased risk. Teens who have a close biological relative with any other type of psychiatric disorder are also at risk. We know that girls are at higher risk than boys. Girls outnumber boys by about twofold in terms of cases of depression. We don't know for sure whether that's a sort of a diagnostic issue, because it's sort of more socially acceptable for females to present as sad, cry, etc., whereas males who feel depressed might sort of manifest it in a different way by acting out or turning to drugs or alcohol. So
it might be harder to diagnose.
It can be. I think in general, males tend to be less likely to seek help, so they're less likely to be diagnosed.
Okay. is there any way that teen depression differs from adult depression?
It differs in a few ways. It can be more erratic. So in adult depression, you're more likely to see someone with a persistently, like, really low melancholy mood for weeks, whereas a teen might present with, like, rapid mood swings. And teens, especially male teens, may be more likely to present not necessarily as sad, but just angry, hostile, irritable, which can be a sign of an underlying depression.
And that would be due to growing up as an adolescent and then mixing that with the depression. That
Right.
makes it more erratic?
Right, exactly. The hormonal changes associated with adolescence make even healthy adolescents pretty moody at times.
And you mentioned earlier that it, of course, it impacts their social life. And are there any other ways it might impact a teen's life being depressed?
Absolutely. By definition, major depression is going to impact multiple areas of a teen's life. So very often teens who are depressed experience social withdrawal symptoms. As I mentioned previously, they might stop hanging out with their friends. They might get into more arguments with their friends. They might do poorly in school. Depression can make it very difficult to concentrate, difficult to retain information, difficult to get motivated, and difficult to be productive. So sometimes depressed teens can't get their homework done, they can't study, and sometimes they just feel apathetic, they just don't care. So definitely academic performance. Family relationships are also affected because, obviously parents who have depressed teens worry about them tremendously. And, as a teenager, you want to be independent. You don't want your parents standing over you every minute. And yet if you're acting in a way that's concerning to your parents are more likely to be on top of you. So that often creates a struggle between parents and teens.
And so these would be other things that parents should also look for. And, well, if a parent sees that their teen is displaying these symptoms or that they're acting in a certain way, what would you recommend that they do if they believe that their teen might be depressed?
I would recommend taking the teen to a psychologist, preferably someone who specializes in adolescence and who has experience in treating depression. So the first step is to have an evaluation with the psychologist and get a diagnosis. It's possible that what the teen is experiencing is just something on the spectrum of normal. And in that case, that's important to know, right? But if the teen is experiencing a major depressive episode, it's important to get that diagnosis and get it treated.
And you specialize in teen depression.
I do.
So you've had different cases of teens who, or parents who might believe that their teens are depressed. You said that you would have to see whether if they're depressed or they're acting normally. How do you usually distinguish between that yourself as a psychologist?
It's difficult. I like to use multiple sources of information. So I would interview the teen for about an hour and ask them all kinds of questions about themselves and the thoughts they're having, the feelings they're having, changes in their lives. I'd want to interview the parents for at least an hour and get information from them about their concerns. And I'd also want to use some standardized questionnaires. There are certain questionnaires that have been developed and validated that can help a psychologist arrive at a diagnosis, that sort of go through all of the key symptoms of depression. And I find that very helpful, especially for teens who aren't terribly vocal, because sometimes something will show up in a questionnaire that the teen didn't mention themselves or that the teen didn't notice themselves. So usually it's sort of a combination of an interview with the teen, an interview with the parents, and standardized questionnaires.
So it's definitely not an easy task.
No, it's not.
A very long process. What about friends? What can they do if they believe their friend is depressed?
Well, friends can be very important in terms of helping a teen cope with depression and recover from depression. I think if a teen is concerned about a friend, I would recommend talking to that person and strongly encouraging the person to go to their parents, and strongly encouraging the person, if they don't feel comfortable going to their parents, to go to the school counselor or a trusted adult. I think that depression is something that can be very serious and that needs to be managed professionally. So if the teen who is showing signs of depression is refusing to tell their parents or the trusted other trusted adult, I would recommend that friends go directly to the parents and express their concerns. That actually happens quite a bit.
It does?
Friends who are concerned that their friend has a problem with depression or anxiety or an eating disorder or something. Teens spend a lot of time with their friends, and so friends are often among the first people to notice when something's off.
Mm-hmm. And you said sometimes the teen might refuse to go to a parent or to a counselor. Do you believe that's more so because they don't care, they're apathetic towards their own feelings of depression, or because they're afraid to, they simply just don't want to? Are there reasons for that? Or?
Well, I think there can be any number of reasons. Sometimes it's a matter of apathy, just simply not caring. Sometimes the teen believes that they don't have a problem and that it's the parents that are the problem. That's actually pretty common. The problem isn't, that the teen is cutting themselves or thinking about suicide or failing school. The problem is that the parents are trying to control their lives. So sometimes it's that sort of issue.
So they don't view themselves as depressed, more so their parents just bugging them more, just being more annoying.
Right, and that's a difficulty when it comes to diagnosis, because depression really changes a person's personality and a person's perceptions, a person's thoughts and feelings. So when you're depressed, you're not thinking normally. You're not thinking clearly. Right. Everyone seems to be on top of you. Everyone seems to be bugging you, annoying you. So it's, especially for someone who is more of like an act out type of person, they might be more likely to attribute the problem to other people.
Right. And you mentioned about cutting themselves or suicide. Do depressed teens usually resort to these methods, or is it not as common?
Well, I would say self-injury I wouldn't say teens usually resort to it. I would say some do. I don't have exact statistics on that, but my guess would be maybe 10-20% of teens with depression injure themselves. It is a problem for some teens, and it generally occurs when a teen is feeling overwhelmed, having very powerful emotions, and doesn't know how to cope with them.
So they kind of try to take control, or feel that they're taking control of it by hurting themselves, or
not necessarily taking control, but more of a release.
Okay.
Because when you have a physical injury, the body releases endorphins. So in a way, it's kind of like a high, similar to what you would get from a drug. Especially for people who are sort of wired that way. Some people are just, for reasons unknown, wired to get some sort of a high from injuring themselves, and it also it's a distraction. When you're physically in pain, you're less likely to be focused on the mental anguish that you're feeling.
Your brain focuses on the more powerful feeling first.
Right.
Continuing on, would you say the teen might be afraid of going to someone because of a social stigma attached to being depressed? Is there a very big social stigma attached to it, or is that maybe something the teen might believe for no reason?
I think that unfortunately there's a huge social stigma attached to depression and all psychiatric disorders. I think it's better now than it was even 10 or 20 years ago, but it's still quite bad, to the point that I think most people erroneously believe that depression is somehow different from heart disease or asthma or diabetes, that it's somehow different, an indication of a weakness or a failure in character, which it's not. There is no difference between a psychiatric disorder and a disorder of another bodily organ or function. So I think that a lot of teens are understandably concerned about that, and I think it becomes especially concerning for teens when they're applying to colleges, when they're in college and applying to law school, and when they're in situations applying to the military, where they need to disclose any diagnosis that they may have, and that they may be discriminated against for having that diagnosis. And that is very wrong, in my opinion, but sadly it's the reality of life for many people.
And you would say that's pretty common?
Oh, yes. Oh, yes.
What about treatments for depressed teens? What sort of treatments are there?
Well, the most effective of the psychological treatments is called cognitive behavioral therapy, or CBT for short. That is, it's a relatively short-term treatment, generally lasts about 3 to 6 months, and it involves helping people learn about the relationships between their thoughts, their feelings, and their actions, so that they can start challenging unhelpful patterns of thinking and changing patterns of behavior that are actually exacerbating their depression, and learning skills to help them cope.
Are there any other methods? You would say that's the most common.
I would not say it's the most common. I'd say it's the most effective. There are all kinds of methods out there, many of which don't have any science behind them. But CBT does, has been studied rigorously in clinical trials, and it has been shown to be effective. In terms of other treatments, antidepressant medication can be helpful for some teens. Generally, teens with mild to moderate depression will respond well to CBT alone. But some teens, those who have more severe depression, or those who have like a depressive phase of bipolar disorder, usually need medication as an adjunct to their therapy in order to help them recover.
So those teens would be referred to a psychiatrist?
Correct.
For medication?
Correct. And I think it's important to get a good diagnosis from a psychologist first, and explore options. I think one of the problems with going directly to a psychiatrist is that you're more likely to walk out with a prescription, and that may or may not be necessary. So I think that it's important to get an accurate diagnosis and look at what your options are. Is this something that can be treated with therapy alone? If so, my recommendation would be not to use the medication. On the other hand, if this is something that will require medication, then I would go ahead and make the referral to the psychiatrist.
So if medication isn't needed, it's best not to
right,
to delve into
because
that.
Yes, because all medications have side effects, and you want to make sure that the benefits of taking the medication outweigh the potential risks.
And at least for teens who do CBT, you said, most of them recover from depression? Yes,
most of them do.
And how long would you say, how many months or weeks do they go through CBT?
I would say between 3 and 6 months. For some people, it's longer. It's really very individualized. A lot of it depends on, how quickly the teen responds to medication too. If it's a teen with severe depression who needs medication, sometimes they're so depressed at the beginning that it's even hard to work with them, and they need to try a few different medications before they can get to the point where they can actually have a conversation and start to feel motivated to overcome some of their difficulties.
So many come in and they don't really want to talk, and that's where medication might come in.
Right. Sometimes medication can help someone participate in therapy.
And so pretty much, let's say if a parent is worried about their teen being depressed, and it turns out that they are, and they go get treatment, there's a pretty good chance that the teen, at least if they get CBT treatment, they'll be pretty well off.
Yes.
They'll do pretty well.
Yes. Most teens do recover from depression. It's a very common illness, but it's also a very treatable illness.
Okay. Well, thank you very much, Dr. Ravin, for being on the program. It was a pleasure having you.
It's a pleasure to be here. Thank you.
Thank you. Well, there you have it. Tune in next time for the next program, and this was Teen Depression.